5 minutes after 11 o'clock. Thank you for tuning in. I am never considered a great chef in any way, but I'm pretty good at one thing. There's something I'm really good at. I have a good reputation. It's tuna noodle salad, and here's my recipe. It's just a box of noodles, a whole jar of mayonnaise, and then a couple of cans of tuna fish, and voila, I have my famous tuna noodle salad. So I made my famous tuna noodle salad one day, and I put it in one of those Tupperware things, and I closed the lid and burped it, and all the things you're supposed to do. And I brought it to this outdoor picnic over in Rainbow Springs.
That's right, with my family.
With your family, yes.
Yes.
And nobody wanted to eat it. And I thought, gosh, everybody loves my tuna noodles. How come nobody's eating it? Well, there's mayonnaise in there, and it's been sitting in the sun, and it could be poisonous. And I said, oh. Well, then I didn't even want to eat my own noodle salad. So, Dr. Mark Pimentel is on the phone. He's the director of the gastrointestinal motility program at Cedars-Sinai. He's the director of the Pimentel Laboratory and the lead investigator of the report showing that anti-CDTV and anti-vinculin, I'm reading, I guess you can tell, antibodies in the blood are associated with and indicative of IBS-D, which is irritable bowel syndrome. We're going to learn about all these things in a moment. He's on the phone right now, I think on the West Coast, because I heard him say it was 8:05. Mm-hmm. The role of food poisoning in irritable bowel syndrome, and that's why I used my tuna noodle salad as an intro here. Dr. Pimentel, good morning, sir. How are you?
Thanks, Larry. I love your intro.
Good. You would love my tuna noodle salad, too, but I guess I shouldn't bring it to an outdoor picnic anymore.
Well, I'd have to taste it first.
So am I right? You're on the West Coast?
Yeah, West Coast in Los Angeles.
All right. Well, thank you for getting up early to do this. Am I right, though, in this kind of application to what I just said, is that when we go out to these picnics, we might be introducing something into our bodies that could cause us a big problem?
Well, this is July 4th weekend. Everybody's barbecuing outdoors, and food sits out there, and it gets contaminated. And I think what we now know is that food poisoning from things like your noodle salad, hopefully not your noodle salad, but things like that, can contribute to the development of this chronic illness called irritable bowel syndrome, and that's what we're talking about today.
So, yeah, the word chronic scares me. So irritable bowel syndrome is something that you can't really get rid of?
It's very difficult to get rid of, and we think that in the food poisoning there's toxins that actually damage the gut through these antibody production that you mentioned, and then you get this chronic illness where the gut just doesn't flow correctly, and then bacteria build up in the gut, and that's irritable bowel syndrome.
So what is irritating the bowel? What is the word? What is it? What is IBS? I guess that's the best question.
Well, maybe I should start by saying that, right now, 10 to 15% of the U.S. population has IBS. So we're talking about 45 million people in the U.S. with this disorder. It's characterized by abdominal discomfort and pain and either diarrhea or constipation and a lot of bloating. And these patients, when they get these attacks, they're doubled over in pain, and it's very debilitating. Though the most important thing is it can affect people who are 20 years old can have it. People who are 80 years old can have it. So it doesn't discriminate by age.
Do you learn, if you have it, do you learn what foods are triggering it, or is it not triggered by foods?
Well, once you have it, what we think is going on in a majority of these patients is that because of all the disruption that occurred from their initial food poisoning, that the gut doesn't flow correctly, and bacteria, your normal bacteria, build up. So if you eat things like dairy now, you get bloated because the bacteria are fermenting it higher up. Fiber and a lot of other foods make the bloating worse. So you end up being on these very restrictive diets to try and help yourself because physicians haven't had good treatments for this in the past.
Do antibiotics change our ability to digest food? I read that somewhere.
Well, so antibiotics can have good effects on the gut and bad effects on the gut. In the case of this condition, rifaximin is an antibiotic that was approved by the FDA to get those bacteria out now that they're there and make IBS or irritable bowel syndrome better. But there are other antibiotics where they destroy everything in the gut, and they can cause other types of infections or bugs that have the opportunity to accumulate, like C. difficile, which is a type of very nasty infection of the gut.
Really? And so the medicine that you just talked about, that sounds like good news. That sounds like a hopeful piece of information.
Yeah, that's hopeful for the diarrhea side, because 1 year ago that was approved by the Food and Drug Administration for the treatment of IBS with diarrhea, on the basis of this being due to bugs accumulating in the gut.
Oh, wow.
No, sometimes I see babies with pacifiers in their mouths. I have never used them on my children because I'm just not a fan. But then I'll see the parents tend to them. If they start to cry, the parent will put the pacifier in their own mouth just to hold it there while they tend to the baby, and then give it back to the baby. I mean, that shouldn't be a good practice, should it?
Well, there's a lot of things that could be said about that, but I think what's important in terms of the pathogenic bacteria, the bugs that really cause illness, they're usually not on the floor, not in your mouth. They're residing in humans who are sick. And now people think that all these bacteria around us in the ground and just on furniture and stuff don't really hurt us. So I've changed my 5-second rule to a 15-minute rule. If it's on the floor for 15 minutes, I'm kidding.
You had me believing you.
Oh man, I was going to use that from now on. How long has that been on the floor? Oh, I'm fine.
But my point is that, the stuff that's just on the floor generally is not the stuff you need to worry about. It's somebody else who's in the back washing the dishes at a restaurant who happens to have diarrhea and doesn't use proper hygiene. Those are the things that need to be watched for.
And there's no way to watch for that.
There's no way for you to watch for that.
Can we use that IBS check? Does the doctor have to use it on you, or can we? Is it something we can purchase over the counter? Or?
So this new thing is that we can. Before, IBS used to be thought of as maybe psychological. We didn't know what was going on, and we always, as doctors, if we don't know what's going on, maybe it's psychological or in your head. And this new test says no, it's from food poisoning. At least in 56% of IBS cases, it's food poisoning. This test, if it's positive, you have IBS. A patient gets a confident diagnosis within 2 days, and they get to treatment. And so previously it could take up to 6 years for a doctor to say, okay, look, we've done everything, you have IBS. Colonoscopies and all this wasted money and expenses and patients going through procedures. Now you can do this in 2 days.
So
wow.
I went to the website ibscheck.com, and check is spelled CHEK. And on that website, can we learn more about this? Because you know what happens? People listen to the little radio interviews, then they go to their doctors and they can't remember half of what we said. And neither would I. I have a hard time remembering everything. So the website would be helpful.
I'm worried that people are going to be eating off the floor now.
Yeah, right.
That's too funny.
But the website is ibscheck.com, and there's a lot of information there. I mean, doctors can order it through their offices, but they have to have the kit. But Quest Labs offers it, so that's universal. It's across the country. It's easy to get.
Okay.
Oh yeah, we have those here.
Yeah, we
Quest.
do. We do have a Quest Lab here. Yeah, don't we?
Yes, we do.
So now we know that. So does it feel? Does IBS, for the person who doesn't have it diagnosed yet, does it feel like, I don't know, like a gallbladder problem or the kidney stones? What does it feel like?
It's just often patients stay at home. They don't see their doctor because the doctor said, look, you got to live with it. But it's this nagging bloating every day, day in, day out, and this sudden, unexpected bouts of diarrhea. Those are typical symptoms of irritable bowel syndrome. And, because you don't have diarrhea every day, one day might be better, and then the next day you're hit again, and this is the tragedy of this. But what if you knew you had diarrhea every day, you could predict your day. But if it's coming just out of the blue unexpectedly, and you're on the freeway, or you're in your office, or you're at a meeting, or you're on a podium giving a lecture, it suddenly strikes you. I mean, this is miserable, and this is what these patients experience. And again, 45 million Americans have this. This is not a small number.
Is there a place on your IBS Check website that patients can actually send emails to doctors with their questions?
I don't think there is on that website, but there's a lot of information for both patients and doctors. So there's kind of two buttons. Press the patient button if you're a patient, and there'll be a lot of information about how the test works and what the new thinking is.
All right.
This is wonderful.
Doctor, thank you for being on the air with us. Have a great 4th of July weekend, and thank you for getting up early. And for the listeners, the takeaway is the website, ibscheck.com, and check is CHEK, ibscheck.com. Thank you, Doctor.
All right. Take care then.
All right. We will be right back.
weather is brought to you by myfwc.com. Safe boating is no accident. We'll see clouds and some sunshine on this Friday with a couple of showers and a heavy thunderstorm or two, mainly this afternoon and this evening. The high today 87 to 91. Mostly cloudy later Friday night, low 72 to 76. For Saturday, partly sunny with a shower or thunderstorm in the morning. A couple of stronger thunderstorms in the afternoon and evening, high 88 to 92. From the Florida Weather Center, I'm meteorologist Joe Lundberg.
The sound of the bat cracking, the crowd cheering, the smell of overpriced but tasty hot dogs, the memories that will last a lifetime of your first baseball game with little Johnny. Your team wins. It was a great night until you get home. It's 9 p.m. and your wife says you have no water.
We have no water.
What do you do?
What do you do?
Rule number 1, don't panic. Remain calm. Okay, that's 2 rules.
We don't have time for jokes, funny man.
Okay, think back. On the way home, you heard a radio commercial.
Mike Scott Plumbing. If water runs through it, we do it.
Eureka! You saved the day. You remembered that Mike Scott Plumbing doesn't charge extra for nights, weekends, or holidays. You are a genius.
Hey, Mr. Genius, did you remember the phone number?
Of course you did. Remember, you're a genius. 352-237-2888. Because at Mike Scott Plumbing, if water runs through it, we do it. Even if water's not running through it at this particular moment. Mike Scott Plumbing.
Hi, this is JP from Penn Flooring here in Ocala. I would like to invite you to come in and visit our spacious showroom where we have solutions for every style and budget. From wall-to-wall carpet to hardwood floors and tiles, we have an unsurpassed selection of flooring. At Penn Flooring, we've provided quality customer service with a family touch for over 25 years. Visit our website at pennflooring.com or come by our showroom, 1201 Southwest 17th Street, just over the bridge. Penn Flooring, quality customer service with a family touch.
You've got a garden and we've got a show for you called You've Got a Garden with your host, Master Gardener Carol Ann Baldwin. Carol Ann answers your questions about your flowers, your veggies, your grass, your trees, even questions about your bugs. And she's only on WOCA, so don't miss Carol Ann Baldwin and You've Got a Garden each Tuesday from 9 a.m. to 10 a.m. right here on WOCA The Source.
Good credits, bad credits. It's none of our business because we're not an auto dealer. We're not a bank. We're not your mother. We're OcalaForSale.com. Marion County's marketplace for cars, trucks, and SUVs. We've got thousands of sellers standing by to take your call. No middleman. But hurry, don't walk, don't run. Just sit down and log on to OcalaForSale.com. Prices and inventory change daily. Offer does not include dealer upcharge. Undercutting, rust proofing, factory surcharge, or delivery fee. See website for details.
We are The Source, WOCA.
Here are today's headlines from The Source, WOCA. The Florida legislature passed 272 bills during the session of 2016, and 159 of them are taking effect today, the first day of July. The budget is the big one, $82 billion to keep state government running for another year. And Governor Rick Scott says there are plenty of tax cuts included. He said, we've cut taxes 55 times, and with this tax bill, we'll cut taxes by $1 billion over a 2-year period of time. Another new law is the Pastor Protection Act, which says churches and clergy who object to same-sex marriages cannot be forced to take part. Opponents call it discrimination in the name of religion. And another new law speeds up the processing of DNA evidence in sexual assault cases. Also effective today, pharmacists statewide will be allowed to dispense the counter-overdose drug called naloxone without a prescription. Naloxone is effective in the event of an overdose by reversing the effects of heroin or other opioid drugs long enough to get the patient to a hospital, and can be administered by injection or nasal spray. Health officials say this can potentially save the lives of those who have overdosed on opioids, and it marks a significant measure of help in dealing with certain forms of prescription drug abuse. In 2014, officials say Florida hospitals handled nearly 12,000 prescription opioid overdoses and 1,925 heroin overdoses. According to the 2014 National Survey on Drug Use and Health, an estimated 6.5 million Americans misused a prescription drug in 2014, and the Centers for Disease Control and Prevention reported a total of 47,055 drug overdose deaths, which include prescription and illicit drugs during the same year. A Tallahassee man is dead after an encounter with two police officers outside of his home. 36-year-old Patrick Keeney was armed and two shots were fired, one by Keeney and the other by an officer. But the police officer missed, and Deputy Police Chief Darrell Furaseth says Keeney apparently shot himself. He said that was based upon the initial assessment of the scene, physical evidence recovered, and most importantly, the recovery of the officer's bullet within a fixed object. Police say they don't know who fired first in the exchange between the officer and Keeney, but it appears that the officer's shot missed completely. Police are extending their sympathies to Keeney's wife, who had called them in the first place to report her husband had a gun and was threatening to kill himself. Both officers who responded to the scene have been placed on administrative leave until the investigation is complete. 1 by 140 of the 41 cars at the Daytona International Speedway received an Orlando United sticker yesterday, but one driver will have more than just that sticker. It's something drivers and car owners say they take pride in doing, to honor those that lost their life, in particular to pray, and prayers to everyone who lost a loved one there, said team owner Joe Gibbs. But former Sprint Series champion Bobby Labonte's car will take it a step further. The entire hood of his number 32 car will be covered with a tribute to the victims. He says this is the least he can do since he does not know anyone directly involved in the tragedy. One other driver, Jimmy Johnson, will also pay tribute to one of the victims, Antonio Brown, during tomorrow's race. Those Orlando United stickers will remain on all 41 cars throughout the weekend. Independence Day traditionally ranks as one of the year's deadliest holidays due to drunk driving crashes. For those that did not plan ahead, Tow to Go will be there to provide a safe way home. Whether you are a AAA member or not, you can call for a Tow to Go ride anytime through 6 a.m. on Tuesday, July 5th. And those are the headlines from The Source, WOCA 96.3 FM and 1370 AM.
The weather is brought to you by myfwc.com. Safe boating is no accident. We'll see clouds and some sunshine on this Friday with a couple of showers and a heavy thunderstorm or two, mainly this afternoon and this evening. The high today 87 to 91.